Hello, Lab community. Thank you for joining me in this presentation today. I want to talk to you today about COVID-19 vaccines and what students, families, and staff need to know following vaccination. So what to expect. After you receive the COVID-19 vaccine, you may experience some side effects. In most cases, these are normal and indicate that your body is building an immune response. Oftentimes, we are seeing a local injection site reaction, which might be characterized by pain, tenderness, or swelling. And on occasion, we also see systemic after effects, which might include a fever or chills, headache, fatigue, muscle aches, and joint pain. In some cases, however, systemic symptoms, as we know, may be indicative of an active infection. So a question I'm often asked is, if I've been vaccinated, how can I develop a COVID-19 infection? So it's important to be aware that it can take several weeks to build an immune response following any vaccine. For COVID-19 vaccines, the full effect of the COVID vaccine occurs several weeks after the second dose in a 2-dose vaccine series. So there's still a period of time in which you could potentially be exposed and develop an active infection. So the bottom line here is that we want to continue to take steps to protect ourselves and others from COVID-19 even after getting the vaccine. So if you experience any combination of systemic symptoms after vaccination, we want you to stay home and get tested. So the protocol for symptoms after receiving the COVID-19 vaccines. Any student or staff member who experiences symptoms after receiving a dose of COVID-19 needs to inform the lab health office prior to reporting to school, or if symptoms were to develop during the school day, immediately following onset. So below, I've included a summary of the return to school requirements, local injection site reaction, like I talked about, a possible allergic reaction, or a mild systemic symptom consistent with known side effects. So non-respiratory, no fever, just a mild reaction, aches, headaches, that sort of thing. No school restrictions associated with that. However, if you experience any combination of systemic symptoms, a fever of 100 degrees or higher, or any one severe systemic symptom, or any symptom that's consistent with COVID-19, so something respiratory or any of the others that are on our list of known symptoms for COVID, PCR or NAAT testing, that's a molecular test, is required. You will need to remain home until results are received and you're asymptomatic for 24 hours. The reason for this is because it can take some time for immunity to develop. We want to be able to rule out a potential COVID-19 active infection in the event that you have been exposed in the community or at the vaccine site. We can't know that. So if you have any severe symptoms, please make sure that you get tested. A copy of our protocol will be included in the email associated with this presentation. So did you know there is a program called BeSafe? It's an after vaccination health checker. You can use your smartphone to tell the CDC about any side effects or symptoms that you're experiencing after receiving a dose of the vaccine. It is a free smartphone-based tool that uses text messaging and web surveys to provide personal health check-ins after you receive a vaccine. And depending on your answers, someone from the CDC may call to check in on you and get more information. So to register for BeSafe, visit the web link included here. It's besafe.cdc.gov. And after you get your first vaccine dose, once you download this app and program your date of dose into the system, it can also remind you to get that second dose when needed. So depending on which vaccine you receive, it will calculate the number of days and give you a prompt when you need to get your second vaccine. In addition to acting as a health checker and having the availability for somebody from the CDC to check in on you and follow up if you do experience any severe side effects or reactions to the vaccine. This also provides a significant amount of data regarding vaccines, which really helps us better understand people's reactions to the vaccines. So helpful in a lot of ways. What we don't know about COVID-19 vaccines. So although the vaccines are effective at keeping you from getting sick, scientists are still learning how well the vaccines prevent you from spreading the virus that causes COVID-19 to others, even if you don't get sick. So this can be a little bit confusing, and I often get the question, if I'm vaccinated for COVID-19, how can I spread the virus? So if you're vaccinated, you may still be exposed to the virus that causes the disease. And after exposure, people can be infected with or carry the virus that causes COVID-19, but not feel sick or have any symptoms. We call this an asymptomatic infection. So essentially what may happen is the virus enters your body, and as the vaccine is designed to do, it initiates an immune response and fights off the virus. You don't actively get sick from it. But it's possible that you are a carrier of the virus while it's in your system, and you could potentially spread that to others. And so it's for that reason that it's crucial that we continue to implement our prevention strategies to reduce the risk of transmission in school, even after vaccination. And for this same reason, we are upholding our school protocols for COVID-19 at this time. So we do need to continue using all the tools available to us to help stop this pandemic as we learn more about how COVID-19 vaccines work in real world conditions. So as I mentioned, the lab protocols for COVID-19 do remain in effect regardless of vaccination status. So this includes, but is not limited to, quarantine due to symptoms of exposure to or diagnosis of COVID-19, molecular PCR or NAAT testing after symptoms, exposure, or travel, all PPE and mask wearing protocols, cleaning and disinfecting, and physical, otherwise known as social distancing protocols. So I know that was a lot of information in a short period of time. So if you do have any questions, please do not hesitate to reach out. We are available at the Lab Health Office. Our contact information is listed below. You can also reach out to me directly at my email address or the same phone number, and I'm happy to answer any questions you might have, any assistance that you may need making a vaccination appointment, anything at all, feel free to reach out. Thank you so much for watching this presentation, and we will talk again soon. Bye.